renal stone is not that much pretty common, but it's day by day increasing. So we need to know the entity, how we could get on these renal stones for our children. So many a times it can be possible that it is mistreated or overtreated with antibiotics by misdiagnosed as UTI. Even if a single time stone is there, we need to do extensive investigations, because few of the cases will have some of the underlying genetic disease or metabolic disease which needs to be picked up early and treat differently. So today we are going to discuss on a very interesting topic, that is renal kidney stone in children. Though apparently it may seem that it is one of the rare disease, but in current scenario, day by day, the incidence of renal stones is actually increasing. Maybe that because that our lifestyle has been changed. Most of the diet issue, water intake issue are causing more and more stone problem in children. Maybe it's possible that the diagnostic systems are getting improved, so that's why more stones are being picked up. So on a nutshell, kidney stones in children means there are some pebbles like material that forms in the kidneys, or maybe in the urinary draining system that are called usually ureters, and may also be in the urine bladder also. But for children, stone in the urine bladder is actually very less in comparison to adults. So if we want to know that how many children over the world or in India is affected, there is no certain current data about Indian children, but overall renal stones for adults is not at all uncommon. It is around 1 to 5% in Indian subcontinent at least. It can vary because in Western countries where the diet and food habits are something different, they have a more higher incidence of stones. And in case of some hot humid environments, just like Saudi Arabia, there are around 20% chances of renal stone in adults. Children only represents only 2 to 3% of those adult stone formers. So as overall, renal stone is not that much pretty common, but it's day by day increasing. So we need to know the entity, how we could get on these renal stones for our children. Basically, how these children present to us. Many of the children present to us with some form of pain abdomen, but again, in comparison to adults, where they can specifically tell about the pain which is coming starting from the back and going to the front of the abdomen, which is medically called loin to groin pain, may be possible that the adolescents or the older children can complain like this, but younger children who are at least verbal, they can only tell some pain abdomen, non-specific, and younger infants, they can only have some non-specific cry, which reason is not known. The other symptoms which are pretty common can be a red urine or blood in the urine. There can be some symptoms of burning during urination, burning sensation during urination, maybe cry during urination. That may represents that there is ongoing some urine infection along with the stone. Or many a time it is possible that there is renal stones which are in the urinary bladder or below that, they are causing these types of burning, micturition or urgency, which are not causing urine infection per se. So many a times it can be possible that it is mistreated or overtreated with antibiotics by misdiagnosed as UTI. So, and many of the children with this type of renal stones are actually having no symptoms. They have done some ultrasound or X-ray which picked up the stone, and the X-ray or ultrasound was done due to some other reason, unrelated reason. Maybe there was some pain abdomen, but the pain abdomen is not due to the stone, but some due to worm, due to gastritis, due to constipation, etc. So overall, these stone formers, if they comes to us, in comparison to adults where stone is not that uncommon, so it's adults coming with a single small stone which can be passed away by his own through the urine by increased water intake only, their investigations are actually limited. But for pediatric age group, for children, even if a single time stone is there, we need to do extensive investigations, because few of the cases will have some of the underlying genetic disease or metabolic disease which needs to be picked up early and treat differently. So most of the causes of stones in children are basically some metabolic problems, means some body's enzymes, some body genes are not good, they are defective, and so that's why they are some part of the disease. So once these stones are formed, we need to do some first to pick up the stone. We need a abdomen X-ray or maybe a abdomen ultrasound. It's pretty good to pick up the stone, but at least we need 2 or 3 times this ultrasound to be done, because to confirm the stone's positions, number, etc. Then comes the specific urine test. Different urine biochemistries are done to pick up which type of stones can be possible. Either it's a calcium stone, it can be oxalate stone, something like this. And then there are some certain blood tests like calcium, phosphate, PTH, blood, urea, renal function test, urea creatinine, etc. Most of the stones does not cause kidney failure as such. There are some rare examples like our cystinosis or primary hyperoxal, which we are quite concerned in pediatrics, because these stone formers will have very kidney failure in very early life. So they need to be picked up, they need to be treated early, otherwise we have a bad outcome. And once these stones are diagnosed, that time they need to be treated well. Most of the stones as per etiology may have some specific treatment, but overall most of the stones are treated with a very huge amount of water intake per se, less amount of salt intake per se, and if feasible rate amount of animal flesh or high protein animal proteins, a little bit less amount. And many times we start on some urine alkalizing agents, some syrups are there which are treated for this stone. But if the stone is a bigger one or is causing some obstruction, then need a conjoint surgical intervention also. So that time it may be needed some both nephrology and urology combined intervention, that is called nephro-uro intervention. So in our hospital we have this facility, but with these student with these children with renal stones, at least once the stone is diagnosed, it's better not to ignore the stone. It's always better to contact your child specialist or the pediatrician who is nearby to you, and if your doctor feels feasible, then they can refer to you to a pediatric nephrologist or a pediatric nephro team, whichever he or she seems to be comfortable. So with that, we think that regarding these kidney stones, we have some of the doubts and ideas we have cleared it. So we are happy to help you 24/7. So thank you.